This segment of DelmarvaLife is sponsored by TidalHealth.
The human body is an incredible thing. When healthy, the freedom and quality of life we enjoy is astounding. Living an active and pain-free life is important to so many of us, and when our mobility is threatened, it can cause problems in all aspects of our lives.
And thankfully, at the intersection of science and medicine, healthcare professionals in the field of orthopedics have been using the latest technology to make joint replacement a truly life-changing procedure. And we are so happy to be here this afternoon with Dr. Thomas Beck with Atlantic General Orthopedics to explain more. Doctor, thanks for joining us
Thank
this
you for having me.
afternoon. I want to get started off talking a little bit about you. Tell us about your background and what kinds of surgeries you do on patients.
Sure. I'm originally from Philadelphia. Did all my training in the Philadelphia area. I did a fellowship in hip and knee replacement at the University of Pennsylvania. I moved to the Delmarva area in Berlin about 24 years ago.
Wow.
Been working at Atlantic General since then, and doing about 50% of my practice is hip and knee replacement, and 50% is general orthopedics.
Very cool. Yeah. Can you tell me a little bit about what the Corey Robotic system is?
So the Corey Robotic system is a computer navigation system that allows us to connect the patient's body to the computer through some pins and arrays and sensors. Then we can take the knee through a range of motion, check the stability through the range of motion, check the alignment, and then when we're replacing an arthritic knee, all this data is put into the computer, and then we can design a plan that perfectly aligns the knee, balances the ligaments, and provides the full range of motion. Prior to that, what we used to do is drill some holes in the bone, put alignment rods in, make cuts, and then manually test it, and it was based on the surgeon's feel and eyeball, and then we'd have to go back if we weren't happy and make recut. Now we can do all that stuff through the computer, and it saves steps, and it makes it much more precise in the alignment of the knee.
And that obviously improves the procedure for both you and the patient?
Yes, and you know, we're all worried about how long the things are going to last, and the best alignment and balance we found has provided the best outcomes for the patients.
Can you tell me a little bit about what is Oxinium and how does it compare to traditional implants that's used for joint replacement?
So Oxinium is it's actually an oxidized zirconium metal where the metal is treated with heat and oxygen, and the outer layer is transformed into a ceramic. Okay. And ceramic is very hard and scratch resistant, and it has very good wear properties when it rubs against plastic. The Oxinium implants have been laboratory tested to last for 30 years. Also, when we do knee replacements, often we use cement, and there's little bone debris that can cause scratches in the components in traditional metal. And those, when you have a metal that has some scratches in it, it's now become a file. So therefore, it can make the wear generation quicker. So the Oxinium actually resists those scratches.
So with the Corey-assisted surgery and Oxinium implants, how does it provide a better long-term solution for active people?
So as we said, the Oxinium implant has been tested to last for 30 years in normal wear. So if you take a material that has a longer wear life and then you put it in the most perfect alignment you can get, we think it's going to last the longest. Much like your car tires. If you're driving your car with the front end not aligned, their tires are going to wear out quicker. So this helps us to minimize the wear debris generated with knee replacement surgery.
And so if somebody watching this today is interested in joint replacement option therapies, how do you get to scheduling an initial consultation?
Calling our office would be the best way. It would be the numbers 410-629-0366, and also the Atlantic General website at atlanticgeneral.org.
And of course, we'll have all that information on our website, DelmarvaLife.com. Click on what's happening today. Dr. Thomas Beck, thank you so much for coming in.
Thanks.